HealthInsight, the business that we're about is really improving the healthcare system. And when we say redesign, it includes both delivery system itself, but also payment redesign that better aligns payments with the outcome sought and the incentives that tie to that. We're looking to help support the triple aim: best care, best health, reasonable cost. So we look to do that in the Western US, and we welcome partners at the table, both providers, payers, purchasers, and the patients that have a voice in our healthcare system. So thank you for being here with us today. So what you'll gain today, hopefully, is the ability to relate the strategy of strengthening primary care to the high-value service programs that we'll talk about. Also, that you will walk away valuing the alignment of these programs with both the Million Hearts Initiative and the Medicare Quality Payment Program. And lastly, that you'll be able to connect to tools and resources that are available to you to support implementation in your practices of these high-value services. So let's get rolling. So primary care, with its emphasis in patient engagement, care coordination, and prevention and wellness, is the foundation of an effective healthcare system. Studies consistently support the relationship between primary care and optimizing health system performance, here represented and by the triple aim elements of improving patient experience, improving population health, and reducing costs. These are critical elements to a sustainable healthcare system, and we believe primary care is the key foundation for that system. Let's see. If you have any experience with HealthInsight or any quality improvement organization like us, you will likely recognize that we are tasked to support various activities or initiatives at the national or state level, all working to improve the healthcare system in some way. What I want to share with you today is a strategy that seeks to align these initiatives for providers through a focus on strengthening primary care. The way we do that is through new services and billing codes that we've referred to as high-value services. The four primary care services available for use today are the annual wellness visit, transitional care management, chronic care management, and advanced care planning. Most of what will be covered today relates to the Medicare Part B or fee-for-service payments. But many of these same or similar services are available through Medicare Advantage plans and other commercial payers. Make sure to check your insurance payer contract arrangements for specifics. So, I mentioned the four high-value services. I want to get a sense from our audience today, and again, it might be a small population, but let's get an understanding of, oh, here comes our poll. Thank you, Rebecca. To get a sense of what you're doing, please take a moment to respond to the poll that popped up and tell us which of these best represents the services you have implemented for your patients. I recognize that some of you may be somewhere in the middle with 2 or 3 of these services. If that's the case, please select the one which you most recently began providing, or which is newest to your staff and patients. Otherwise, if it's doing all of them, mark E. If you're not doing any of them, mark none. So, are you providing annual wellness visit, transitional care management, chronic care management, or advanced care planning? All of the above or none of the above. So, probably have had a chance to respond. Rebecca, can you go ahead and pull up the results? There they are, thank you. So this is great. So it looks like there's some beginnings. I don't know our population, but 50% of the respondents said annual wellness visit was implemented or the most recent implementation. 25% said TCM, 25% said chronic care management, and another 50% said advanced care planning. That adds up to more than 100%. I am not a statistician, but I think I'm misreading or misunderstanding. So, oh, it's multiple choice. Excellent. Sorry for the gap there. So this is great. Looks like we've got implementation, although somebody hasn't started any of them. So really, I hope today to provide information that will bolster what you've already begun, give you some sense of we're doing the right thing, and maybe encourage consideration for adding additional services. So thank you for your responses to the poll today. So next up, beyond the triple aim that I talked about of health, improved health, patient experience, and lower costs, we also see these high-value services as possible business use cases for high-performing practices in the new world of value-based care delivery and payment. We see these services and their reimbursement dollars as providing some relief on financial burden through fee-for-service, while investing in staff resources and infrastructure, as well as likely increasing your patient engagement, increasing overall quality of care, and decreasing total spend. I know this sounds like pie in the sky aims, but I hope to bring it down to realistic levels to show the connections to things that your practice team values, which you'll, on the right-hand side of this slide, hopefully some of those things resonate with you. So, for those that may not be familiar with these services, or as a refresher for others, I will give a very brief summary of each. Seeing that most of them have been implemented, I will go through these pretty quickly. Please feel free to add in the chat if you have an additional question or you want to see something a little bit longer. So first, annual wellness visit. This can include any of three services. The first one, which is Welcome to Medicare visit, or the initial preventive physical examination. Also, the initial annual wellness visit, so the first time a beneficiary receives an AWV, it is slightly more comprehensive and requires more items with that initial AWV. And then the subsequent annual wellness visits, which are ongoing annually following their initial AWV year. Again, this is similar in form and substance for Medicare Advantage, as well as the information you're seeing for Medicare Part B billing and the G codes and round number reimbursement amounts. So a little bit more, AWV is not, or sorry, is a wellness visit, is not an annual physical exam. And patients sometimes struggle with understanding because historically it's been all about the physical exam. So, but it can be a very important vehicle for good patient care. It is an opportunity for the provider to ensure that a patient's risks are accurately documented. It's also an opportunity for the patient to talk to their physician about their goals, things that are important to them. So less about what's your current status, what are your lab results and things that you might get in a physical. It's an opportunity for the patient to talk about where they see their health and wellness wanting to be. Medicare says the annual wellness visit is best furnished to a beneficiary when their health status is stable and they are open to discussing preventive and screening services available to them. The AAPM, the Academy of Family Practitioners, say Medicare's annual wellness visit is a way for your practice to keep patients as healthy as possible. As healthcare moves from volume to value-based models, the AWV addresses gaps in care and enhances the quality of care you deliver. A personalized prevention plan created for the Medicare beneficiary is a way to improve patient engagement and promote preventive health care. So that's the annual wellness visit. Next, briefly, is the transitional care management. Approximately 1 in 5 Medicare beneficiaries in the United States are readmitted to the hospital within 30 days of discharge. Unfortunately, 76% of these are actually, those that happen could be preventable if we took the right approach to that follow-up care. A common reason for readmissions is the absence of timely follow-up appointments with primary care providers. Thus assisting patients with their new diagnoses, their new medications, treatments they may need. TCM is an opportunity for providers to receive additional reimbursement for taking that responsibility for the care of patients following discharge from an inpatient hospital setting and returning to home or an assisted living facility. One key element of TCM, if you haven't gone down that path, is having an effective notifications upon discharge so you can do the necessary outreach and follow up to see the patient and to meet the requirements for the payment. Okay, that's TCM. CCM, an estimated 117 million adults have one or more chronic health condition. 1 in 4 adults have 2 or more. These patients require additional time and resources. This is nothing new to you as provider or care teams, but CCM is a payment opportunity that's available for Medicare fee-for-service patients that have 2 or more chronic conditions that hopefully reimburses for care that you're already providing. It's a critical component of care that contributes to better health outcomes and well-being for patients and individuals with multiple chronic conditions. It also builds patient loyalty and trust in their care team because they know they have 24/7 access, better coordinated care with their specialists, and reduces hassles for really the clinicians, the patients, and their caregivers. So again, you're probably already going to extra lengths to help support your patients with chronic conditions. CCM, if implemented effectively, can get you that additional reimbursement that you deserve. Okay, I know I'm going fast. ACP. Lastly, the ACP, or Advanced Care Planning Service, enables patients to make important decisions and give them control over the type of care they receive and when they receive it. When implemented effectively, ACP will likely enhance patient-centered care and strengthen the provider-patient relationship. It can ensure that the provider understands patients' wishes and can guide treatment accordingly. It can reduce the emotional burden and cost of unwanted interventions and futile care. And lastly, it can improve family coping and reduce burden on the caregiver in those stages of life. The best part for you is that the AC and the patient is that the advanced care planning can be added to the Welcome to Medicare visit and AWV as a preventive service for additional billing revenue with no co-payment or impact on the patient. So if that's one you haven't looked into, it's a pretty good one to tack on to your annual wellness visit program and get that additional revenue and the benefits to your practice and the patient. Okay, so if Rebecca, if you can copy that chat for our strengthening primary care, that link into the chat. Say hello to our providers in strengthening primary care on the web. Here you will find online toolkits and resources to assist with education, implementation, and improvement of the 4 high-value services in your practice. Just click on any of the 4 provider circles on this webpage to dive into that section and learn more. For example, I don't know if you can see my cursor, but I've clicked on our annual wellness visit provider. On this webpage, you'll see that we have a downloadable implementation guide along with additional resources and tools, including resources from Medicare, forms and tools, additional education, patient-facing tools and resources, and even tools to consider potential revenue and return on investment. Our downloadable implementation guides are at the heart of our online resources. They provide simple steps to consider and do in preparation for and during implementation. We've even included the ever-challenging billing and coding information. These guides also include summary recommendations and easy steps to support both initial implementation and ongoing improvement. I mentioned our revenue and return on investment tools and resources section, the highlight of which is our business case calculator. This can be used to compare recent levels of use of these codes with the potential revenue available. You set the targets and it calculates projected revenue and projected costs and ultimately the net revenue you could expect to see. If you work directly with HealthInsight to get this calculator, we can provide you with, based on CMS data that we have access to, with where you've been in the past in billing these codes, and then work with you to set targets and see the comparison of revenue potential with previous revenue. So that's an exciting thing we can provide. So I want to now look at the world that you live in, or that you've come to this Million Hearts webinar series for. I want to talk about how these high-value services align with cardiac and hypertension care and with the Million Hearts campaign. Each is slightly different in the level of direct alignment or impact, but I have listed out some of these potential areas of alignment. I won't go through these in great detail, but I would emphasize annual wellness visit as a highly aligned program with cardiac and hypertension. It really helps to address with the patient their health status and risks, including blood pressure, smoking. It can assist in identifying and supporting referral to treatment and follow-up care. CCM and TCM are also well aligned, especially when the patient has a related condition. CCM becomes impactful when enrolling patients that have hypertension as one of their chronic conditions, providing more comprehensive engagement, support, and care coordination between office visits. And where a patient's inpatient stay is related to a cardiac event, the TCM program will ensure effective and timely follow-up with their primary care team. Lastly, advanced care planning doesn't directly impact cardiac and hypertension measures or goals, but it does, as mentioned, support better engagement and strengthens the primary or the provider to patient relationship. I'm going to skip over the next, well, actually this slide I'll just show. So this one is an example of the annual wellness visit elements and how it supports the Million Hearts goals and measures through specific required elements that are part of the annual wellness visit process. These other ones I won't go through. I've pretty much talked about them already. That will be in the slide deck for your reference, but it's just a further description of the TCM, ACP, and CCM, alignment with cardiac. I'm going to jump us to another area that I said I would mention, which is the Quality Payment Program, sometimes better known as the Merit-Based Incentive Payment System, or MIPS. Something that's probably front and center for all practices right now, as we've completed the reporting year and now have the next 3 months to report to Medicare on the QPP or MIPS program. This slide, very busy, I apologize for that, but it does recognize that all 4 high-value services correlate to objectives and measures in the MIPS program, and when implemented effectively, will support meeting or improving upon your scores. This slide shows only a high-level overview of the alignment. The full detailed alignment is available as an appendix to this slide deck for your reference. But in essence, you can see that each of these 4 MIPS categories, quality, improvement activities, promoting interoperability, and cost, are shown with the corresponding service alignment. So, for example, improvement activities, it's usually the easiest one to get, but you can see if you're missing or needing an improvement activity, that pick any of the standard high-value services we've talked about, and they will help you meet the improvement activities requirements. Same for other areas of the MIPS program. And I will just mention cost. I know sometimes in the MIPS program, that's kind of a second thought. It's all done automatically for you through claims, but a recognition of how you can impact cost and your cost score this year and going forward is to recognize how these high-value services can impact and support decreasing overall total cost of care for patient care. So I encourage you, when you have some time, go through that appendix, understand how these services relate to the MIPS program. So I will just mention the other pathway alongside of MIPS is the alternative payment model pathway in the quality payment program. There's also strong alignment between the high value services and the APMs due to the emphasis on quality and cost to ensure a positive payment outcome. We have been working in support of various accountable care organizations, ACOs in our region, and all of them that we've worked with have these high value services in their initial chapters of their playbook for success. So if you're there or thinking of heading in that direction, starting these programs can jump you ahead and make you better ready or more successful in an ACO arrangement or other alternative payment model. So with that, that concludes my presentation portion. I know I went through a lot of detail, a lot of information, and I'll take questions in just a moment, but I do want to learn from this group. You've started these implementations. Please use the chat or raise your hand function and share with us any advice or your challenges with implementing these services. Now it's your time to share.
Thanks, Wyatt, and I'll just jump in again too, and just remind you that really this is the best way from you to learn from each other. It sounds like some people have already implemented. It'd be great to hear if you have some tips for people. Perhaps you joined today because you're struggling with something specifically, and you want a little help. So we're happy to entertain all of that. But let's get some things started in chat, or feel free to speak up. As I said at the top, we're a small and intimate enough group that it'd be great to have a conversation.
So I know that you've had challenges. None of these are a plug and play, flip a switch, and they just work for you. So let's hear. So I'm seeing some. Lisa Whitlock mentioned our challenge is helping our providers understand that there is a difference between an AWV and a CPE. I'm not familiar with that acronym. I'm assuming it's a physical exam, a comprehensive physical exam maybe. Yes, I mentioned that in the emphasis of not, complete physical exam, thank you. That being clear to the patients in the communication and the outreach for annual wellness visits, it's important to emphasize that it isn't. But what we like to do is emphasize what it is and what value it can add to them, their relationship with their primary care provider, and ultimately helping them maintain or improve their health status and minimize their risks going into the future. Really gives them a deeper opportunity to engage with their provider, and we like to emphasize that. Thank you for sharing that, Lisa. You're not alone, and even in our tool set, we do have some sample letters or sample phone scripts that you could look at and use in your outreach to patients in communicating the difference between an annual wellness visit and a physical exam. GGNNN, my patients refuse to come in if they aren't sick. Again, a great example of sometimes we as patients only see the benefit of getting fixed, getting a solution to our acute problems. And we need to change both the healthcare system's engagement, but also the patient's engagement and empowerment to recognize that they play probably the most important way of them avoiding seeing us for sickness or illness or injury is recognizing how to impact your health overall outside of the physician practice. So, and the best way to do that is that deeper engagement, helping them understand their role. And some of these things can help, but again, it's important that the communication and the messaging is supportive of that. We appreciate your challenges, and we hope that the materials that we share on our website can help support you in some of these challenges. Excellent. And as mentioned through the webinar, know that we have a whole team, and I'm actually going to go ahead and move us on. to explain that we'll continue taking questions, so please add to the chat now with your questions to the slide. If you have any questions, please feel free to chat those in, and I'm actually going to pause a moment to let Rebecca re-explain the details on the end to facilitate this. But I do want to, because I know some people will drop at the Q&A session. I'm going to jump ahead, a reminder about our Strengthening Primary Care on the web. Please see us there. Please feel free to contact me if you're desperate. But more importantly, we have a whole team available to support you in your challenges with implementation or working to improve at least one of these high-value services in your practice. Know that you're not alone in this journey. Please reach out to us. So with that, I'm going to go back to, please, Rebecca, if you'll take over and step us through the facilitated Q&A.
Hi, yes, and surprise, I'm a different Rebecca. The other Rebecca had to jump off really quickly for something, but one of the questions we get for folks, and it looks like on this call there are a lot of folks who have already implemented annual wellness visit or the TCM especially, and so some of the questions we get are, you know, what do I do now? I've been doing this visit type for 2 years, but we can't seem to bump up over that 30% threshold, and we can't get more patients to come in, and how do we get to the next level so that this is happening for all of our patients?
Excellent. Great question, Rebecca. I will just respond with saying HealthInsight as a quality improvement organization, that is what we do day in and day out, is we help practices look at where they're at, where they want to get to, and what's the gap, what's the barrier holding them back. And often it involves processes, whether it's workflow processes, engagement processes with the patients, and we can help you set goals, run what we refer to as PDSA cycles, which is really just a set a goal, act out with process to improve that goal, check the status, is it improving things? If not, make adjustments. If it is, keep going. And HealthInsight staff can help you with those practice improvement or process improvements. We speak to that in each of our implementation guides. So I recommend, if it's you've hit a plateau with transitional care management, go find our guide, look through the section on sustaining improvement, and contact your local HealthInsight representative, and they can help you work through those processes. Great question. Thank you, Rebecca.
Great, thank you. And it looks like our last question is about slides, and I know we said that we would send these to you via email afterwards, but I'm wondering, Wyatt, if you could just scroll really quickly through some of the appendixes to give people an idea of what is going to be coming in the slides so they can look forward to that.
Yes.
And then if we have any other questions, I'll take them at that time.
Excellent. Yeah, and with the smaller group that we have today, we can probably, if you registered and gave us your email address, we will send out the slides to the full group. But just to give you, so you've seen the slide deck. The appendix, however, goes into a little bit more detail specifically on the strengthening primary care alignment with MIPS. So this really goes into detail around each area. So this is the annual wellness visit and the quality section of MIPS, and it steps through different areas or domains, which measures are high priority, and can help you kind of see if you're struggling with what do we report in MIPS and you're already doing annual wellness visit, here's things you should be considering reporting. If you're considering doing annual wellness visit and you want to see how your MIPS, it might impact your MIPS reporting, these are those measures that you can look to have improved and impacted from an annual wellness visit. Excuse me, and it steps through, so here's annual wellness visit improvement activities, promoting interoperability and cost. Again, the cost one I'm excited about because it's usually kind of a blind spot. Practices don't know that they're impacting costs, but these high-value services are impacting total costs and total Medicare spend per beneficiary. That benefits not only your MIPS score for cost, but also, again, looking forward to alternative payment models. you know that you're going to be effective in those types of models, shared savings or shared risk, by doing some of these things. So here's TCM, ACP and MIPS, and CCM. So you'll have this full set of slides in that slide deck as part of the appendix as a preview.
Great, thank you. And I don't see any additional questions, so unless we get some, I just want to say thank you so much to everyone who's joined us today for the call and taking the time out of your schedule. I'd love to give you some time back in your day. And thank you also so much to you, Wyatt, for preparing these slides and walking us through this. And I know on the back end, on the HealthInsight and there's been a lot of work and time put into these materials. So thank you so much for sharing with us today.
You're very welcome. Thank you all.
All right, thank you everyone, and we'll sign off and hope to see you next month.